Welcome to Smart Steps, brought to you by Podimetrics, the podcast where we dive deep into the intricacy of living with complex diabetes, from feet to full health. We're on a mission to save limbs and save lives by shedding light on the challenges, solutions, and innovations that impact people with diabetes, their care teams, and the broader healthcare system. Each episode will explore a different perspective, whether it's from healthcare providers, payers, advocates, or like today, employers, so we can better understand how diabetes care fits into the bigger picture. I'm your host, Erin Perkins. I work on the marketing team here at Podimetrics, where I help tell meaningful stories about diabetes care. But most importantly, I'm here to bring you conversations with thought leaders that challenge how we think about diabetes and its ripple effects. Since this is our very first episode, we're kicking things off by looking at the critical role employers play in preventing diabetes complications, especially when it comes to foot health. Why does that matter? Well, because employees with diabetes face a 34% lifetime risk of developing a diabetic foot ulcer. These ulcers don't just limit mobility, they're the leading cause of amputations. That impacts people's lives in major ways, and it affects workforce productivity, absenteeism, and healthcare costs. In fact, a single amputation can cost up to $100,000. Here's the good news. There are strategies and solutions that can help, and we're going to explore them today. To help us unpack all of this, I'm thrilled to welcome Dr. Gary Rothenberg. He's a podiatrist and an adjunct clinical associate professor at the University of Michigan Medical School and the director of medical affairs here at Podimetrics. Dr. Gary has spent his career helping people with diabetes, both in clinic and through innovative prevention efforts. Dr. Gary, welcome to the show. Before we dive into today's discussion, can you share a little bit about what drew you to this field and why diabetic foot health is such a passion of yours?
Thanks, Erin. It's a pleasure to be with you today, as well as be with the listeners. Thanks for having me.
Yes, absolutely. It is an absolute pleasure.
Thanks, Erin. Yeah, I appreciate the kind introduction. And the one title that you didn't mention is actually dad. And probably one of the most important roles that I actually have is being a parent. And I have 4 kids, but I actually have a son with type 1 diabetes. And so for me, though I've spent nearly a quarter century in practice, and my practice in podiatry has always focused on lower extremity complication prevention in people with diabetes. 10 years ago, when my son, who's now 19, was diagnosed with type 1 diabetes, I say the universe kind of spoke to me. And now diabetes has more of a face. It was always feet for me, but now it has a face. And so this is something really important, near and dear to my heart, to make sure that people with diabetes, even my son, live healthy, productive lives without complications.
Well, thank you for sharing that background. And that is probably one of the most important titles that you could have, is being dad.
That's right.
So just to kick us off, I'd love to set the stage by talking about a real life example of a patient. And I know that you've worked with a lot of patients, and I'm sure you have some great examples of stories to share with us. I would love to hear firsthand how the impact of diabetic foot complication can impact someone working. I know there's one particular story that you have about a Ford employee. Can you walk us through what happened and what we can all learn about prevention through that story?
Yeah, so appreciate that. Obviously, again, I'm in Michigan and we're in Ann Arbor, which is right outside of Detroit. And so, yes, my practice is made up of a lot of folks who work in the auto industry. And this one gentleman that I think you're referring to, I met him in our emergency department, unfortunately, with a very significant limb and life-threatening infection one day. And it wasn't until his daughter actually saw drainage coming from his foot and unfortunately smelled the odor from this diabetic foot infection that she insisted that he come to the emergency department. He had a very significant foot infection and he ended up losing half of his foot. And this is because of neuropathy, the lack of feeling, the fact that he's a factory worker, that he stands on his feet, has to wear steel toe shoes to work, and that combination of pressure, walking, neuropathy, and a foot deformity unfortunately landed him in the emergency department, hospitalized for about a week, underwent two separate operations, the first to get the infection under control, and then secondarily to actually try and close that open wound. But the story doesn't end when he leaves the hospital because he was literally out of work for 9 months. There were several complications. The mainstay recommendation that we have as surgeons or as foot care specialists when you're trying to heal a wound or heal a surgery is you have to be off of your foot. Obviously, if I put stitches in somebody's foot and they walk on it, those stitches can open up. And then I haven't helped anybody. So he had, unfortunately, several complications and was out of work for 9 months. I essentially saw him every week in our wound clinic and followed the progress and went on that roller coaster ride with him up and down with progress and then setbacks. But meanwhile, you can imagine the significant quality of life impairment that he had, as well as the effect on his work and on his personal life.
Wow. That is quite an impact on someone's quality of life, as you mentioned. And I can't imagine that he expected that when he went into that ER that day. Do you mind going back a little bit and explaining a little bit more about neuropathy, just so people understand who may not be familiar what that is and how that impacted his situation?
Yeah, I always say in my work life, neuropathy is the root of all evil. What
Mm.
happens is people with long-standing diabetes or poorly managed diabetes where their blood sugars are not in the target range, the elevated blood sugars that circulate in the blood system actually starve the nerves of the oxygen and nutrients that they need to survive. And so people actually develop significant symptoms, which often alone impair quality of life. So people can develop burning, tingling, pins and needles, and then numbness is kind of the end stage. And while numbness may sound like, okay, that's not a big deal, it really is a big deal because I have plenty of stories around patients who literally step on things and they have no idea that they've stepped on a nail or that they've stepped on a carpet tack and they have no idea that that puncture has occurred because of the dense numbness that they eventually develop. I had a professor in school, he said, pain is a gift that no one wants. But truly, for those of us that don't have neuropathy, even if you wear a pair of shoes that maybe felt great in the store, but then actually wearing them, they are rubbing you and irritating, and you know you're going to get a blister. So you stop wearing those shoes. But
Hmm.
people with diabetes and neuropathy don't have that feedback loop to either have them consciously or subconsciously modify the way that they walk. So it's really that numbness and that combination of neuropathy and then activity and deformity of the foot that sets people up for these wounds.
Wow, thank you. That is such a helpful explanation and really paints a picture of like the impact and what a great way to say that pain is a gift, something that we probably take for granted.
That's right.
I would love to hear more about this particular patient. What his experiences were, the challenges that he faced after he had this ordeal and he's gone through having this partial amputation of his foot. What happens from there?
Yeah. Well, again, a little more detail about him. He had been with the automotive industry with his employer for almost 30 years. It's kind of one of these, right out of high school, he goes to work and he stayed with them for a long duration of time. But he was kind of on that fringe or in that bubble, if you will. Like he wasn't quite ready for retirement. His maximum pension wasn't there. And he was a guy who shows up for work every day because it was the right thing to do and because it paid his bills for him. And so, of course, as you mentioned, that day he went into the emergency room, he had no idea that it would be almost a year by the time he got back to work. So, yeah, the challenge is like staying off of your foot. He did live with his adult daughter, which was helpful in terms of support. But unfortunately, many folks may live alone and they have to still, go to the bathroom and prepare meals and grocery shop and things like that. And so, staying off of your foot is a real challenge. But of course, then he enters into this unknown world of dealing with his HR department, short term disability, long term disability. We're always optimistic that things are going to heal quickly, but there are setbacks. So, those challenges of he still needs to pay his light bill, but he's not able to go to work every day. So, that plays a physical and emotional toll on these people. And again, I saw that every week as I visited with him. And I had a role in that too. I had to fill out his paperwork on a monthly basis. So, and try and use my crystal ball to predict when was this episode going to be over. And that's a challenge even after doing this for 20 or 25 years. It's hard to predict those things.
Wow. Um, I can't even imagine what that had to be like for him. And I think you did a wonderful job explaining how it impacted him. Probably, of course, physically, but emotionally, and just with his independence. And it's great that he had his daughter there with him, because I imagine it helps to have someone that can be a caregiver for you.
Absolutely.
I would love to hear more about how this impacts employers. And what would you say, like, why should they be invested in helping employees like this?
Yeah, it's a great question. And it reminds me of what I heard from a colleague at one point, and he said turnover in skilled manufacturing is just plain expensive, right? So I think of my patient who had been doing his job for 30 years. He knew what he was supposed to do every day. His employer trusted him. There was obviously some training that went into that, investment that went into that. So, of course, trying to train somebody different to do that job is expensive, and the disability claims, of course, as well, that the employers have to end up dealing with. But I think most importantly, it's the work that needs to be done that we're all relying on in these challenging times, especially. So I think the employers want healthy, productive employees. And that's really the goal. And that's what we're trying to promote through prevention type activities as well.
Thank you. So, Dr. Gary, for those who may not be familiar, let's talk about diabetic foot ulcers. We hear the term, but what exactly are they and why are they so dangerous?
Yeah, so we actually know that there are some really alarming statistics around diabetic foot ulcers. And again, in simple terms, most people may be familiar with the term ulcer from a stomach lining, right? You develop this hole in your stomach lining, and that's called an ulcer. Well, diabetic foot ulcers are obviously a hole or a break in the skin on the bottom of the foot, typically in people with diabetes. They really are very complicated because that hole or that break in the skin represents an opening, a portal between the outside world and the inside world. And bugs and bacteria and fungus and other viruses, as you can imagine, that live in and around our feet can get in and invade and set up local infections. So it's this cascade of events. A wound can get infected. If there's an infection, and these patients, we talked a little bit about neuropathy, they don't have that feedback. They don't feel the infection starting. So it's just allowed to progress and get worse. And that's what may end up, like my patient, landing somebody in an emergency department. And then they're facing hospitalization. And unfortunately, when the infection gets deep enough and involves the bone, that's when people with diabetes are at risk for amputations. So they really are dangerous in that it is a causal pathway. And unfortunately, many of these patients, it's too late and the infection is in control and dictates and mandates what we do. And then you also add the component of poor circulation. Many patients with diabetes have circulation issues. And just by having diabetes alone, then you add on other risk factors like smoking. And those are really bad combinations to try and heal those wounds. So if you end up with an amputation, any of us think about how our lives would be affected if you ended up unfortunately losing a limb or a half of a foot. The emotional toll, but the physical ability to do your job, to drive, to be productive, those are all significantly affected.
Thank you for that very insightful explanation of that. I know that will be very helpful to the listeners to understand. So, I know that the statistics are very shocking and that diabetic foot ulcers and amputations actually have a higher mortality rate than, I think it's 5 of the most common cancers. Can you talk a little bit about that?
Yeah, it's an interesting analogy. And not to take away from cancer, we know that many of our families have been affected by that. But when somebody is diagnosed with cancer, everybody immediately says, well, how do I get rid of it? And if we think about infections and diabetic foot ulcers in the same way, and you are correct, breast cancer has about an 8% 5-year mortality. And we've made lots of great progress in cancer research and treatments. So if breast cancer 5-year mortality is about 8, 9%, diabetic foot ulcers have a 47% 5-year mortality. So 3.5 times the mortality associated with diabetic foot ulcers compared to breast cancer. And we know there's so much media awareness and educational campaigns. There's something about diabetes and feet that's just less attractive, less sexy, if you will, to people than other campaigns around cancer. But we have the data to know that employers, health plans, and patients are paying the price, literally and figuratively, for diabetic foot ulcer morbidity and mortality.
That's just shocking because you just wouldn't expect that. But framing it in that way, I really think helps give us a really strong perspective of the gravity of the situation and how big this problem is and how common it is, too. So many people who are living with diabetes don't realize that they have a problem until it's too late. Why do you think that early detection, which seems like that is a thing that would be very helpful in these scenarios, why do you think that's such a challenge?
Yeah, it's a great question. And I think that there is, unfortunately, in our healthcare system today, a focus on treatment, right? That we are less preventative and less proactive and more reactive, right? We have lots of medicines to treat health conditions, but are we really focused on what's the reason why? So, unfortunately, diabetic foot ulcers are generally a late stage complication of diabetes, but I will tell you that um, as a foot care specialist, we have statistics that 1 in 5 people are actually diagnosed with diabetes because of a foot related issue, like a wound that doesn't heal. And then again, I see a patient in an emergency room, and not only do I have to tell them that they have a significant foot infection, but they have diabetes. So I think to answer your question, Erin, it's around screening, risk stratification, understanding genetics, getting people and payers to recognize the value of prevention.
It definitely points to how early detection and prevention can be so monumental for helping so many people. So that brings to mind, we know that this problem is serious. So love to talk about the solutions around that. And what if prevention were built into everyday healthcare? And what if employees had access to early detection tools or programs to help them? So I think that's a great opportunity for us to shift to talking about prevention and talking about the Podimetrics Smart Map program, because that's what it's all about is prevention. Do you mind talking about that and just explain to us what it is and how it works?
Yeah. So I've been very fortunate to do some of the original clinical research for Podimetrics and the SmartMat program, which we really are advocating as part of a prevention strategy. And if we want to talk the comprehensive diabetic foot ulcer prevention, then it's really boils down to what providers do and what we ask our patients to do on a daily basis. From my standpoint, it's about education. It's every visit that I have with the patient, reminding them of the risk and doing that in an appropriate way, reminding them to check their feet every day, reminding them to wear their good shoes and inserts, not to walk barefoot, and then also to maintain as best diabetes blood sugar management as they can. It's not easy, and I acknowledge that all the time. And the smart mat, to get directly back to your question, Erin, is rooted in very sound science. Literally over 50 years ago, we were talking about how temperature monitoring can influence and detect potential complications that may be brewing in somebody's foot. So we always understand that inflammation and elevation of temperatures precede illness. Think about anytime you develop a cold or the flu or COVID. Many times the initial sign is going to be a fever. And the foot does the same thing. As we like to say, the foot heats up before it breaks down. So Podimetrics did not invent the concept of temperature monitoring for feet, but we did innovate it. And it's in a very simple to use mat, looks like the size of a bath mat. And we are able to remotely monitor skin temperatures when patients step on this mat, and it just takes 20 seconds per day to develop a heat scan of the feet. And then we monitor that for hot spots or temperature asymmetry, comparing right to left. And in the case where we identify that there's a trend that the foot is potentially heating up, then we have nurses who around the country who are monitoring these patients, and they give the member a call and say, "Hey, Mr. Jones, you know that mat you're stepping on every morning? It's showing a little inflammation. What's going on? Can you take a look at your feet?" And they ask them a series of questions which can hopefully bring out some very important information. So it's not about the data, but the information that we gather around that data that can influence change and cut off that trajectory that we talked about earlier, which is inflammation, infection, hospitalization, amputation. So it's incorporating technology in a useful way to really predict what may be happening and then use low cost, simple, easy to follow instructions and interventions to cut off that pathway towards complication.
Oh, thank you. That was such a helpful explanation. It's such a helpful program and it's integrated. It is a comprehensive program. It's not just a device. We're offering patient support and helping providers to streamline their workflow as well, and helping employers to take care of their workforce too. So, from an employer's perspective, why do you think this matters? If you don't mind touching on that a little bit more, how does prevention affect absenteeism? How does prevention affect people being able to show up for work?
That's right. And it does. It does, Aaron. Again, I like to quote the literature when I can. And the studies that we've reviewed show that unfortunately, return to work rates after amputations can be up to about 66%, but in certain populations, it can be as low as 16% of people actually return to work. So, as an employer, I would think you've made an investment in Mr. Jones. He does his job really well. Again, the things that we've touched on before is that work needs to be done. So, how do we keep people in a way when they are at risk for complications and they have these medical issues that they've developed over the years? How do we keep them showing up for work every day? So, again, I think it has to be through prevention type programs and offering those opportunities and looking at their own data within the population of employees that you have within your workforce.
And for employers who are listening and thinking, this sounds important, but what can I actually do? What would you say are some practical steps so that
Yeah.
they can support um, employees that they have that are living with
Yeah,
diabetes?
that's a great question. Again, probably all this should be data driven, looking at the makeup of the employees through claims data. And what we see when we review claims data is generally a very small percentage of people with diabetes are driving a lot of the high cost of care. So understanding who those claimants are and then offering prevention type opportunities like the Smart Map program for their employees would be really, really great. Offering health screenings, educational opportunities, that's a practical opportunity for employers to do. And then again, gaining information by doing internal data research on who these folks are and is there a burden within the organization that can be addressed.
Thank you. That is very helpful information and such great suggestions. I've found that when we've held health fairs and health screenings at places that I've been at, it's always been so valuable to me. So I love that suggestion. So this has been a really great conversation. I'm so grateful for the time that you shared with us. And one of the biggest takeaways for me is that prevention isn't just about a medical crisis. It's not just about getting to the ER and then that's when we discover everything. It's about helping people ahead of time. So if there's anything that you could leave our listeners with, one key reason why prevention truly matters, what would it be?
Yeah, I think you've summarized it fairly well, Aaron. I think people want to be healthy, productive members of society, right? They want to contribute to their community. They want to show up at their workplace and do what they're supposed to do. And they want to be active in their family. So these types of really life-changing events like an amputation, we can avoid those. We know that prevention is possible. In this particular space, the data would tell us that 85% of diabetic foot ulcers can be prevented. And those that lead to amputation, especially, we want to make an impact and bend the curve around those complications so that people and people like my son can live healthy, productive lives and play football and can go to church and do community events and again be productive members in the workplace. So I think that's really, really important. And probably the final thing I would say is what I teach my students and my residents that I help to train. And that is that you have to treat every person. I encourage them, treat every patient like they are your favorite person in the world, because that worker at Ford is somebody's favorite person in the world, right? So we have to have that attitude, because then if we help them to avoid these complications, then they can live that productive quality of life that they want to.
Well, those are wonderful. Those are absolutely wonderful. Thank you so much for sharing that with us. And I was going to ask you if there was anything else that we didn't touch on that you think it's important for people to know.
Prevention is possible. Prevention is possible. Just do the things, follow, evidence-based medicine, I think, is really important. Following the data, understanding who's at risk, and then doing those evidence-based interventions that are proven to be not only beneficial for the patient, but cost effective for the healthcare system. Those are the things that we should be employing and utilizing on a daily basis for everyone.
Thank you so much, Dr. Gary. That was just such great information. And I just thank you for your time, for sharing your expertise and your passion. And to our listeners, if you found this conversation valuable, please don't forget to subscribe, share, and help spread the word. Prevention should be the standard, not the exception. And if you're looking for more, Dr. Gary has a blog post on podimetrics.com where he draws a powerful comparison between diabetic foot ulcers and cancers, not to equate them, but to underscore the serious nature of foot ulcers. It is thought provoking, it is compelling. We'll link it in the show notes. So thank you all for listening. And until next time, take smart steps towards better health. Thank you, Dr. Gary.
Thanks, Erin, and thanks to the listeners. Have a great afternoon.
Stay tuned, stay informed, and let's keep moving forward, one smart step at a time.